Hi, I'm Dr. Jane Olson from Norwalk, Connecticut and Baton Rouge, Louisiana, and I'm going to demonstrate a patient injection with Juvederm Voluma. Juvederm Voluma has become available in the United States, having been available in Europe and Canada for several years. And this is a carbohydrate type gel filler called hyaluronic acid. And we're able to achieve a lot of lift in the mid-face and fill areas in the frame of the face to soften the concavities of the face and bring the face together. It has a lot of lift and a long duration, approximately 2-year duration. This is to demonstrate the contour of the patient's frame of the face. She has loss of volume in her temples, preauricular area in front of her ears, and deflation in the mid-face. And after the Voluma injections, we're going to show the softening of those concavities of the face. Here I'm marking the patient's face in areas where we see bony loss and facial fat deflation. The areas that are marked are where we're going to add some volume to widen the frame of the face and connect the convexities and get rid of some of these indentations, shadows, and concavities of the face. On our patient, we're going to add volume to the subtemporalis area, or the temples, to widen the upper area of the face and over the cheekbone. You can see if our patient sits forward, that shows us the area of deflation and the area of sagging forward. So we want to pick that area up toward the outside of the face, toward the lateral aspect of the face and the frame of the face, and restore the volume there in order to create lift to correct some of the nasolabial folds in the central face. So this is just starting with adding volume to the apple of the cheek, and the product needs to be injected quite deeply in most areas. We're really down next to the bone and creating a lift underneath the patient's natural soft tissue to lift up her cheeks and reposition them to where they were in the youthful position. So by injecting this area, we should be making our patient look more like they did a decade ago. And creating the lift out toward the frame of the face, the outside of the face, is going to correct the nasolabial fold in the center of the face. A little bit can be added to lift the nasolabial fold up by injecting above it in the cheek fat pad closer to the nose. To continue the correction of the frame of the face, we need to add volume to the temple area. And I'm going to go in quite deep here underneath the muscle to lift the soft tissue and just lift the tail of the eyebrow and widen the face to balance the eye area. And you can compare the right to the left now and see that this temple area is reinflating with the injection of Voluma. We just get a nice soft padding in areas that are skeletonized. And as the voluma is injected, the patient becomes numb, so it's quite comfortable. And we can see, compared to the left side, which hasn't been injected yet, that the right side is nice and softly lifted. Here we can compare the right lifted side to the left side. We're going to inject the left side, lifting the sort of apple area of the cheek, the convexity, to restore that curvature of the upper face. And then continuing more laterally out over the zygoma area, paying attention to the frame of the face, not just the center of the face. And by lifting more laterally, we're going to achieve lift in the nasolabial fold area for correction without injecting the nasolabial fold. And restoring the volume to that medial fat pad area is important in some patients. After restoring the volume in the cheek, we're going to go to the temple area and go underneath the temporalis muscle on the left, and just working it into the area above the tail of the eyebrow to reinflate and lift that convex area. Take away the shadowing and also restore the width of the face in the temple area. And that makes the balance of the eyes look better. Now that we've filled the patient's cheek area and temples, I'm going to connect up the jawline to the cheekbone by adding a little volume in front of the ears and softening that real abrupt hollow beneath the cheekbone. Again, just correcting on the left side the loss of volume that we see in front of the ears. We see the patient post-injection of 2.5 vials of Juvederm Voluma to soften the cavities of the face and restore the convexities. It creates lift in the midface and widening on either side of the eyes.